Clopid ASP pharmaceutical brand manufactured by Ferozsons Laboratories Limited. It contains a combination of clopidogrel 75 mg and aspirin 75 mg, formulated as Clopid ASP. This combination is available in a potency of 75/75 mg of clopidogrel and aspirin. Studies of the brand with references, FDA-approved indications, primarily related to cardiovascular health. Clopid ASP, clopidogrel plus aspirin, is approved by the FDA for the management of cardiovascular conditions such as acute coronary syndrome, ACS, peripheral arterial disease, PAD, and ischemic stroke. These conditions require dual antiplatelet therapy for effective prevention of cardiovascular events like heart attacks and strokes. Bioequivalence of test and reference product. The bioequivalence study compares Clopid ASP, clopidogrel 75 mg plus aspirin 75 mg, with the reference product, clopidogrel 75 mg, showing that both products deliver similar pharmacokinetic results. The study assessed primary metrics such as AUC, area under curve, and C, concentration, ensuring the therapeutic equivalence of the test and reference products. Clopid ASP's relative risk reduction in CV, death, Michigan, and stroke. Clopid ASP provides a 20% relative risk reduction in cardiovascular CV death, myocardial infarction, MI, and stroke. This makes it an effective treatment for reducing serious cardiovascular events in patients with underlying heart conditions. Effectiveness of clopidogrel plus aspirin in high-risk TIA, or minor ischemic stroke. Clopid ASP, when administered within 24 hours of a high-risk transient ischemic attack, TIA, or minor ischemic stroke, significantly reduces the relative risk of subsequent stroke by 30%. This demonstrates its effectiveness in preventing further cerebrovascular events. Clopid ASP risk reduction and relative efficacy in PAD and cardiovascular events. Clopid ASP is shown to be highly effective in reducing the risk of cardiovascular events in patients with peripheral arterial disease, PAD. It provides enhanced outcomes in these patients by lowering the chances of heart attacks, strokes, and other cardiovascular complications. ESC ACS Guidelines 2023 for Antiplatelet Strategies. According to the 2023 ESC, European Society of Cardiology, ACS Guidelines, Clopid ASP is recommended as part of antiplatelet therapy strategies for patients with acute coronary syndrome, ACS. The guidelines emphasize its role in reducing bleeding risk during the first 12 months post-ACS. Risk reduction in subsequent stroke with clopidogrel plus aspirin. Clopid ASP plays a critical role in reducing the risk of a subsequent stroke. The combination of clopidogrel and aspirin is shown to lower the chance of stroke recurrence, particularly in patients who have experienced an ischemic event. Clopidogrel's effectiveness in PAD. Patients' clopidogrel, a key component of Clopid ASP, has been proven more effective than aspirin alone in reducing the risk of major cardiovascular events in patients with peripheral arterial disease, PAD. This makes Clopid ASP a superior choice for managing PAD patients at high risk for cardiovascular complications. Features and benefits of the brand, Clopid ASP. 75 provides a 20% relative risk reduction in cardiovascular death, myocardial infarction, MI, and stroke. Clopidogrel and aspirin combination is beneficial within 24 hours after high-risk transient ischemic attack, TIA, or minor ischemic stroke, reducing subsequent stroke by 30%. Clopidogrel is more effective than aspirin alone in reducing the risk of major cardiovascular events, especially in PAD patients. The combination of clopidogrel and aspirin offers a dual antiplatelet therapy approach that helps to reduce bleeding risks and optimize patient outcomes in high-risk cardiovascular patients. Indications and mode of action of the brand: acute coronary syndrome, ACS, peripheral arterial disease, PAD, ischemic stroke. Clopidogrel, Clopid, inhibits platelet aggregation by irreversibly binding to the P2Y12 receptor on platelets, preventing their clumping together and thereby reducing the formation of blood clots. Dose of the brand with administration guidelines: acute coronary syndrome, ACS. The recommended dose of clopidogrel, 75 mg plus aspirin. 75 mg is typically administered once daily. The combination therapy is used to reduce the risk of cardiovascular events such as heart attacks in ACS patients. Peripheral arterial disease, PAD. For PAD patients, the dose of Clopidogrel, 75 mg plus aspirin. 75 mg is prescribed daily to help reduce the risk of major cardiovascular events. Ischemic stroke. For patients with a history of ischemic stroke or high-risk TIA, transient ischemic attack, Clopidogrel 75 mg plus aspirin. 75 mg is administered daily to prevent subsequent strokes, typically within the first 24 hours of the event. Manufacturing and marketing. Details of the brand name, Clopid ASP, manufactured and marketed by Ferozsons Laboratories Limited, 5 km Sundar, Raiwind Road, Raiwind, Lahore, Pakistan. Clopid ASP provides dual therapy for patients with cardiovascular diseases by combining clopidogrel and aspirin for a broader therapeutic effect. It is promoted for its efficacy in reducing cardiovascular risk and preventing strokes, particularly after high-risk transient ischemic attacks, TIA, or minor ischemic strokes. The combination is marketed for its improved outcomes in patients with acute coronary syndrome, ACS, and peripheral arterial disease, PAD, as well as for stroke prevention.